To really enjoy a good life, our bodies need sleep. Yet every night, 47 million of us struggle getting a good night's sleep. Jenni Dunn, nurse practitioner with Salina Regional Pulmonary, Critical Care and Sleep Medicine, joins me. Jenni, thanks for being on the show. We're going to be talking about sleep disorders, so I think the first thing is to tell us, what are sleep disorders?
Sleep disorders is kind of an umbrella term that's used to describe abnormalities in respirations when we sleep, and it can include obstructive sleep apnea, central sleep apnea, snoring, hypoventilation, hypoxemia.
And how are these disorders diagnosed?
So they're diagnosed with a sleep study, and there's two different ways to do a sleep study. Certain people that don't have a lot of comorbidities, medical comorbidities that are generally healthy can be diagnosed with a home sleep study. But then other people are deemed that are otherwise not quite as healthy, need to go to the in-center sleep lab to have a sleep study.
One aspect of sleep disorders as well is some of the risk factors. Why don't you talk about those?
A lot of people assume that sleep apnea is only a condition that we see in the overweight population, which is, of course, one of the risk factors, but we do see sleep apnea in the thinner population as well. A lot of times it's hereditary, and it a lot of times has to do with the tissue in the back of your throat as well, the amount of tissue or the size of your tonsils as well. And sometimes it can involve your nasal passages as well.
Let's talk about the actual treatment for these disorders. What is the treatment?
The more general ones that we see, obstructive sleep apnea, let's say that's kind of one of the more common ones we see. CPAP is a common treatment that we see. BiPAP is another common treatment that we see to treat sleep apnea.
Actually breathing machines that they wear while they sleep.
Correct, yes. And of course a lot of people think that, oh, the only treatment is one of those big, bulky, full face masks. We've come a long ways as far as masks, and there's very simple masks nowadays that are a lot more comfortable and less invasive for people to wear.
If somebody, or in many cases, the spouse of somebody thinks they might have a sleep disorder or a sleep type problem, what's the best thing for them to do?
They just need to talk to their primary care physician about the symptoms that their loved one is having and discuss it with them, and they can get a referral to the sleep lab for a sleep study or for a potential home sleep study if their physician feels that they are appropriate for that.
And those symptoms are?
Snoring, daytime somnolence, or sleepiness, I guess, waking up with headaches.
Thank you so much for being on the show.
Thank you.
For more information, please visit the Sleep Disorder Center tab under srhc.com, like us on Facebook, and follow us on Twitter and Instagram.